Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Rizwan Ahmed. I am Associate Professor of Biochemistry at Independent Medical College, Faisalabad. In my previous presentation, I have discussed regarding the plasma proteins, their separation techniques, function of albumin, and clinical uses of albumin. Today I will continue with another plasma protein, that is globulins. All the globulins together form 29 to 54% of the plasma proteins. And these globulins are separated by the half saturation with ammonium sulfate, and the molecular weight ranges from 90,000 to 1300,000. By the process of electrophoresis, these globulins are separated into four fractions, namely alpha 1 globulins, alpha 2 globulins, beta globulins, and gamma globulins. Each fraction is a mixture of several globulins, but one of them is present in abundance while others are present in small amounts. All the globulins are glycoproteins because carbohydrate groups are attached with them. Regarding the synthesis of globulins, alpha and beta globulins are synthesized in the liver, and the gamma globulins, they are synthesized in the plasma cells and beta cells of the lymphoid tissues. It is also known as the reticuloendothelial system. The synthesis of gamma globulins is increased in chronic infections, chronic liver diseases, autoimmune diseases, leukemias, lymphomas, and various other malignancies. Now I will discuss one by one by the alpha globulins. They are the glycoproteins, and based on the electrophoretic mobility, they are subclassified into alpha 1 and alpha 2 globulins. The alpha 1 globulins, having example of alpha 1 antitrypsin, or also mucoids, that is also known as alpha 1 acid glycoproteins and alpha 1 phytoprotein. The alpha 1 globulins, these are also known as the alpha 1 antitrypsin. They are also called the alpha 1 antiproteases, and the normal value in adults, it ranges in between 2 to 4 grams per liter. It is a single chain protein of 394 amino acids which contains 3 oligosaccharide chains. It is the major component, more than 90% of alpha 1 fractions of the human plasma. It is synthesized by hepatocytes and macrophages and is the principal serine protease inhibitor of the human plasma. It inhibits trypsin, elastase, and certain other proteases by forming a complex with them. I will discuss the polymorphic forms of alpha 1 antitrypsin. At least 75 polymorphic forms occur, many of which can be separated by electrophoresis. The major genotype is MM, and its phenotype product is PiM. The deficiency of this protein has a role in certain cases, approximately 5% of the emphysema. This occurs mainly in the subjects when other genotype, that is ZZ, who synthesize PIZ, and also in the PISZ heterozygotes, both of whom secrete considerably less proteins than PiMM individuals. The detection of alpha-1 antitrypsin is done by radial immunodiffusions, rocket electrophoresis, and nephelometric methods. The screening of phenotype, it is done by immunofixation methods. Before going to the clinical consequences of alpha-1 antitrypsin, the increase in alpha-1 antitrypsin, it occurs in response to inflammation due to trauma, burns, infarctions, malignancy, hepatic disorders. In chronic hepatocellular diseases, biliary obstructions, in pregnancy, and in contraceptive medications. The neonates have low levels than the adults. In the deficiency of alpha-1 antitrypsin, it occurs in protein losing disorders such as nephrotic syndrome, emphysema of lungs, and juvenile cirrhosis of the liver. So we will discuss here emphysema. Normally antitrypsin protects the lungs tissue from protease. This is the active elastase which is released from the macrophages. It forms a complex with protease and inactivates it. In its deficiency, the active elastase destroys the lung by proteolysis. The deficiency of alpha-1 antitrypsin Smoking inactivates alpha-1 antitrypsin by oxidizing its methionine 358 residues. It inactivates alpha-1 antitrypsin and that cannot bind to the protease, and there occurs a proteolysis of the lung and the tissue develops emphysema. Again, smoking oxidizes this methionine to methionine sulfoxide and thus inactivates it. The affected molecules of alpha-1 antitrypsins no longer neutralize these proteases. This is particularly devastating in the patients, for example, the PIZZ phenotype, who already have low levels of alpha-1 antitrypsin. The further diminution in the alpha-1 antitrypsin brought about by smoking, which results in the increased proteolytic destruction of the lung tissues. The clinical consequences of alpha-1 antitrypsin deficiency also causes the cirrhosis of the liver. In these conditions, the molecules of the ZZ phenotype, it accumulates and aggregates in the cisterns of the endoplasmic reticulum of the hepatocytes. This aggregation is due to the formation of polymers of mutant alpha-1 antitrypsin. The polymers forming via the strong interactions between specific loop is one molecule and the prominent-pleated sheets is another loop sheet polymerization. By these mechanisms that are not understood clearly, the hepatitis results which consequent in the cirrhosis of the liver. The alpha-1 antitrypsin has another role as a tumor marker. It has been used as a tumor marker in the germ cell tumor of testes and ovaries. Alpha-1 antitrypsin also inhibit the fibrinolysis. It is one of the most important inhibitors of the fibrinolysis along with alpha-1 antiplasmin and alpha-2 macroglobulins. All of these are the inhibitors block the action of plasmin and fibrinogen. Now the second alpha-1 globulins are the alpha-1 fetoprotein. It is present in high concentration in the fetal blood during mid-pregnancy. The normal concentration in healthy adult is less than 1 microgram per 100 ml. The level of alpha-fetoprotein increases in the pregnancy. The clinically considered as a tumor marker for the diagnosis of hepatocellular carcinoma or teratoblastomas. And the last one, alpha-1 globulin are the orosomucoids. It is 0.6 to 1.4 grams per liter in a normal plasma, and the carbohydrate content is 41%. The orosomucoid is a reliable indicator of acute inflammation. It binds with the hormone progesterone and transports it. Orosomucoids probably also supplies the carbohydrate for the tissue repair after injury at the site of injury because it has 41% carbohydrate contents. It is increased in acute and chronic inflammatory diseases, and the levels of orosomucoids are seen decreased in hepatic diseases, malnutrition, and nephrotic syndrome. So with the end of this lecture, today we have discussed the globulins, their types: alpha-1 globulins, alpha-2 globulins, beta globulins, and gamma globulins. And very important in a clinical aspect is the alpha-1 antitrypsin and their clinical manifestations. Okay students, Allah Hafiz, thank you.